we get to introduce our three amazing speakers. And I'm going to take a moment here because they all three bring just incredible and very diverse expertise to this talk. So I want to make sure that you know them well. So I will start with Dr. Katie Wilging. Dr. Wilging is a senior research scientist at the Pacific Institute for Research and Evaluation. She's a medical anthropologist with a passion for community-engaged research that uses implementation science to help organizations and systems become more structurally competent when working with people impacted by health and healthcare inequities. Her current collaborative work focuses on using implementation science and mixed method approaches to better understand and address the needs of diverse transition-age youth, school-based health centers experiencing homelessness, and to enable the use of LGBTQ plus inclusive practices in schools and school-based health centers in order to reduce the impact of structurally based factors, including stigma and discrimination that contribute to health disparities and influence the health and well-being of LGBTQ plus youth into their adulthoods. Katie lives in Albuquerque, New Mexico, is a mom of 2 teenagers, and likes to go antiquing and vintage shopping in her spare time, which was a very delightful learning for me because I didn't know that about Katie. And Katie has been here for multiple sessions, and we are very grateful for her returning presentations. The next presenter is Ms. Brooke Tafoya. She's Chief Executive Officer of New Day Youth and Family Services. Ms. Tafoya has over 20 years of experience leading organizations, staff, and movements to better support young people around housing instability, healing trauma, and honoring whole people in every aspect of their lives. She is dedicated to challenging the conventional approaches of service provision by centering strength and building meaningful connections. She has worked in Orlando, Florida, doing community building, and in St. Louis and Chicago, doing violence prevention at both the community and state levels. She has served on multiple boards and is currently a member of the New Mexico Juvenile Justice Alternatives Leadership Committee. She has presented nationally on bullying and cyberbullying, youth homelessness, and strength-based approaches to working with young people. She's an advanced trainer in the Nurtured Heart approach and works both personally and professionally to focus on what is good and strong in every moment. That's so beautiful. Ms. Tafoya received a Bachelor of Arts in Sociology, Anthropology from Principia College and a Master of Social Work from Washington University in St. Louis. She currently lives in Albuquerque, New Mexico with her wife, 3 pets, and a house that is always open to family. And then last but not least, I would like to introduce you to Adrian Lawyer, who is the Director of Education at the Transgender Resource Center of New Mexico. He's proud of having co-founded the TGR-CNM in 2008 with Zane Stevens to be a clearinghouse of service provision, education, and advocacy for the transgender community in New Mexico. He has facilitated over 3,500 transgender cultural fluency training sessions throughout New Mexico, including training every correctional facility in the state, numerous district attorney offices, police departments, public and private schools, healthcare and social service facilities, and countless businesses, non-for-profits, and other entities. Amazing. Adrian has led successful advocacy efforts for model transgender student policies, gender-neutral restrooms, trans inclusion in social service facilities, statewide bullying prevention, and updating the law that governs birth certificate gender marker change. On a national level, Adrian presents and consults on many issues impacting the trans community, including TGR-CNM as a successful model for local service provision. He has been recognized with the Jose Sarria Into the Light Award for Community Service and the Vincent R. Johnson Model of Hope Award for LGBTQ role models. In 2019, Adrian won the Advocacy in Action Professional Innovation in Victim Services Award presented by the New Mexico Crime Victims Reparation Commission. Adrian is a trans man and father. In his spare time, he enjoys playing guitar with a band named Sue. I love that name. Thank you so much. I really appreciate you all three of you being here. I am sure the audience is now knows how much we are in for a treat. And I am going to hand this now over to Katie to start us off, and we'll be around here to help with the chat. And all of you, please introduce yourself in the chat, and then we will also take your questions there. Thank you so much for being here again. And Katie, please get us started.
You're on mute, Katie.
Unmute. Okay, thanks for your patience with me. So yes, I'm Katie Wilging, and I am so delighted to be joined by two of my favorite collaborators, Adrienne Lawyer and Brooke Tafoya. And I'm going to do a little bit of a talking head spiel at the beginning to introduce you to two projects that I've been working on with both Adrienne and Brooke. And then we're going to really spend a large chunk of today doing a moderated discussion about what it means to engage community partners in implementation research. And yes, while I am largely a qualitative researcher and will be talking about qualitative research, much of the conversation pertains to implementation research in general. And I am trying to advance my slides. Let's see. And I am clearly experiencing some, there we go. So what are the reasons why we might want to engage community partners in research and engage in practices that I would consider participatory? One of the primary reasons is the ethical imperative. Institutional and academic research has created lasting harms to many communities in the past, and particularly in the Southwest United States, where Adrienne and Brooke and I are all based. By engaging community partners, we can enable a more appropriate, acceptable, and feasible research design. And having such a research design enables us to create more meaningful and higher quality data. Also helps us to avoid misinterpretation and overinterpretation of data when we include community partners and, really digging into the findings and helping us contextualize and understand their significance. Also, having the involvement of community partners is pivotal to disseminating data in a way that it's going to be more impactful, especially outside of academic contexts. That said, community participation is very celebrated these days, and I think that's wonderful. But sometimes I think we need to be thinking about what are the possibilities of this kind of approach, but what are also some of the things we need to be conscious of? What are some of the problematic dimensions of community engagement that we can maybe sidestep? So what are some of the possibilities of participatory research and implementation science? The first is gaining insight into lived experience and how that lived experience can, really give us a better understanding of what might work, what might not work, and how we can make things work better. It can help increase the chances that our interventions are going to make a difference in the lives of the people we're working with. Can help, as I mentioned earlier, create more feasible research designs, but also enhance our study instrumentation. So we'll know if we're asking the right questions and what's the best way to ask questions, especially if we're working with diverse populations. Also, having community partners makes it possible to identify and tailor implementation strategies for the different folks we're working with. Helps us target training and technical assistance to different end user populations, helps us better understand and deal with implementation barriers, figuring out how we can overcome them. And ultimately, I think having community partners is really important if we want to promote social justice and equitable intervention and implementation outcomes. What are some of the perils? Well, oftentimes research is initiated by the researchers, not always communication with the community partners that ultimately we want to include in our research endeavors. So it kind of puts us in a more privileged, sometimes superior position. So we really have to be thinking about asymmetrical power dynamics and how these can influence our work with community partners. And a lot of these asymmetrical power dynamics have to do with language and communication, how we're engaging people. So implementation science is a field that's full of lots and lots of jargon, even the term implementation strategies. We need to be thinking about how we can make our language more accessible. And we also have to be thinking about diverse communication methods. Technology can often be off-putting to many of our community partners. Some of our community partners don't have access to technology. But if we're using things like email, for example, to engage people, we need to be thoughtful about, is this the best way? So we really have to be thinking about multi-pronged communication strategies. We have to be thinking about the pragmatic challenges, which again have to do with technology, but do people have what they really need to take part fully in research? A lot of the structures that we create for people to participate in research can be very intimidating. Just our meeting structure. And our meeting structure is often tied sometimes to how researchers go about organizing their workday. So we have to be open to engaging people, not only during 9 to 5, but on weekends, in the evenings. We need to make sure they have the means to participate, for example, transportation, childcare. One of the things that I think is absolutely critical to facilitating meaningful community participation is taking the time to develop trust. And we have to remember that trust is an ongoing process. It's not something that's just automatically conferred. And we have to be mindful of how it is that we are engaging communities. We need to avoid tokenism. And that's something that, here in New Mexico, when I've been involved in a variety of, let's say, state organized bodies, there is always this propensity to tokenize, to include that one person who's going to represent everybody. And that's something we need to be thinking about, who we are bringing to the table and who we're excluding. And we need to be, really opening up the channels for people to get involved. We need to be thinking about who really benefits from research. Is it the academic researchers who will write their articles and advance their careers? But how can research truly benefit the communities we're working with? And we need to be thinking about benefits very broadly. And ultimately, we need to have reflexivity about what we're doing from the get-go and throughout the research process, and especially when it comes to how we're disseminating our findings. And I think insufficient reflexivity really can be one of the perils of participatory research. And that's why earlier I talked about participatory research being very, very celebrated, but I think sometimes we're not telling the story about what it really takes to do this work. And sometimes we're glossing over some of these challenges that I just discussed. I think it's really imperative for us to be interrogating what we mean by community and participation. Community is one of those feel-good words. It's a warmly persuasive word, as Raymond Williams said in 1976. And I love it when I get to invoke Raymond Williams in an implementation science talk. But community is one of these taken for granted terms. Community describes a set of social relationships. They can be existing relationships or they could be new relationships. But ultimately, this term community rests on assumptions of consensus, conformity, solidarity, homogeneity. And we have to remember that communities themselves are often full of, a variety of different perspectives. And we just, we just can't think that everybody is going to be holding the same views or experiencing the same things. In our own research endeavors, we have to be mindful of how we define community if we want to avoid barriers to participatory efforts. So I often think about it in terms of what does community mean for the project that I'm engaged in. And I like to work with a diverse array of partners to kind of come up with that definition. That definition that we select really does need to reflect local understandings and realities. And we have to ask, when we're coming up with this definition, whose voices are being prioritized and whose voices are being excluded. And oftentimes in research circles, there's a propensity to include those people who are easy to work with, or that we kind of, construct in a way that, they're going to represent everybody. But we really need to be thinking, like, who's not at the table and why aren't they at the table, and what can we do to perhaps invite them to the table? Much to the chagrin of many people, probably, there is no universal definition of community participation. Same thing in terms of what it should look like and how it should be evaluated. I wouldn't take that as something that should discourage us in this work. I think it actually opens up possibilities to really thinking creatively about community participation. Community engagement really depends on context, and context shifts. So I think it's important to think about participation as a process versus a product. Engagement may need to be multi-level. So the two projects we're going to talk about today are in fact multi-level, and they have multiple avenues for participation. We need to be thinking about creative strategies to facilitate outreach, engagement, ongoing participation, and that includes involving people with lived experience in key decision-making processes. We also need to think about the real-world demands of engagement and how we can balance this with our research. And in implementation science, there really is this need for precision and efficiency and doing things quickly. And we do this using sometimes very formulaic methods and models that in some ways can really make it hard to fully appreciate and leverage what community partners have to offer. Again, it's important to think of participation as a process versus a product. It's not an outcome of an intervention. It's just not a means to get an intervention implemented. And it's especially not a checkbox to fulfill some type of funder requirement or at the behest of some other agent. It's a process that requires long-term commitment on all our parts. So before I move forward, I'm just wondering, Adrian or Brooke, do you want to chime in with anything I've shared?
Well, I was just, Katie, I really appreciated you adding. I actually wrote all these different notes about, who we engage, who the research ends up often, the research that we end up having around certain populations is often because they're more easily accessible. And so I think one example in what we're going to talk about, the project that we were leading around young people experiencing homelessness, is that there's many layers to that, is young people experiencing housing instability, young people who have actually lived on the streets, young people who have been engaged in systems, child welfare or juvenile justice or behavioral health systems, young people who have not been engaged in those systems, and that repeatedly we see research, and I'm not saying we do need it, but research around young people who have been engaged in the child welfare system. And it's because there's an easier way to count, access, and track young people who've been engaged in this type of system. But we have so little information because it is a very hard population to reach around young people who are not systems involved and who are experiencing homelessness, and particularly those who are living on the streets. So it just was really, I just want to highlight and amplify that point, that sometimes the research really is driven by the ease of access.
I think that's an excellent point, Brooke. Excellent point. I do think in terms of strategies for nurturing meaningful partnerships, it's really important to show up consistently, not just when you want to set the meeting time. We need to be committed co-learners. We cannot be domineering or passive conveners. We need to be thinking about research with, not on, And this entails sharing in leadership, sharing in decision-making, and sharing resources. It's really important to continually clarify, address, and revisit roles and responsibilities, as well as training and support needs. It's important to be building on everybody's strengths, to anticipate compromise, and to also work on, as we mentioned earlier, cultivating trust. And ultimately, we have to be mindful of power and positionality. We have to be reflective of our practice and how we can improve on it. And I think something we'll talk about later is also being open to critiques of the evidence base. So in implementation science, we're all concerned with implementing evidence-based practices. And I think one thing that, Adrian and Brooke can both speak to is there's not a lot of evidence-based practices for the populations that we're working with or serving. And part of it has to do with what Brooke just mentioned, the ease of access. But, Adrian, I don't know if you want to comment on, the issue about the evidence base when it comes to trans health.
Yeah, this has been a huge sticking point for us because evidence-based practices for trans people in New Mexico would come from the work that we're doing. But we're a community-based organization that has been chronically under-resourced, so we can't pay to engage the folks who would come and certify our practices as being evidence-based. We can't afford to take the time and the money that it would take to say, hey, this intervention we've been doing, we know it works because we can hear it from our community. We can see the results, but we can't call it evidence-based because we can't engage in the academic process that would allow it to be labeled evidence-based. So it becomes a really like self-reinforcing thing. And when you have emerging populations, not really, but emerging in people's minds and people's awareness, like trans folks, of course, there's nothing because we didn't even acknowledge trans people, 20 and 30 years ago. So how could we have evidence-based practices that are good for trans populations when we wouldn't even acknowledge the population in the first place? You think about stuff like Native American folks out here too, like what you're saying, like populations that have been so long ignored. How can you have evidence-based practices for them, right?
And that's definitely one of the challenges that we experience with some of our implementation projects, because we're being asked to first provide that evidence base. And the work involved in that takes a lot of time. It takes a lot of resources, but yet we have a good sense of if we try to do this on a larger scale, it's likely to make an impact. So I'm gonna move on and talk a little bit about two projects that I think reflect processes of co-creation. They weren't necessarily developed with the notion of co-creation in mind, but I think they've come to reflect the spirit of co-creation. And co-creation is a collaborative process in which community and research partners really do work along each other to accomplish synergistically specific goals that are set together. It's like community-based participatory research. It's about advancing health equity through relationship building and providing equitable means for participation. It really centers on self-reflection and reciprocity. It's ideally a transformative process to support knowledge production and sharing, skill building, and mutually beneficial relationships, and ultimately co-created outputs. And I think co-creation is about facilitating longer-term relationships for more meaningful community intervention and implementation research. So today we're going to talk about two projects that address public health crises that require equity-oriented solutions. And the first is a study where I first met Brooke and really was able to engage in a co-learning relationship. And this focused on assessing the needs of and system responses to transition age youth between the ages of 18 and 25 who are experiencing housing instability and homelessness in Bernalillo County, New Mexico. And Bernalillo County is where Albuquerque, the largest city in New Mexico, is located. It is our biggest urban center. And we had to do this project in a really short period of time. We started working on the project before, we had the funding, but we had a 6-month funding timeline from start to finish. And the second project involved Adrian, and this focused on reducing LGBTQ adolescent suicide and other harmful health outcomes through school-based interventions. And this was a statewide initiative, involved high schools everywhere in New Mexico. It was over 5 years, and it involved a process we'll talk about called the dynamic adaptation process. Both projects were informed by the exploration, preparation, implementation, and sustainment framework. And I do believe both studies have key elements of co-creation in common. So both studies, as I'm hoping to highlight today, had multiple opportunities for engagement. And I'm wondering, Brooke, if you can just tell us how the needs assessment was kind of launched.
Sure. There was a group that there was not a youth committee initially, but there was the Albuquerque Homeless Coordinating Council that was all local governmental entities coming together with providers, but it was completely focused on adult housing solutions. And about 3 years ago, a youth subcommittee was added. From that subcommittee, we developed 3 key targets of next steps. And the very first one was that we needed an assessment to really count the number of young people experiencing homelessness, because all the current mechanisms were showing that there were about 200 young people in the greater Albuquerque area that were experiencing homelessness. And we knew this was a huge undercount because of the way that people are counted, and particularly young people are missed, because young people and adults are often not actually in the same places when they're experiencing homelessness. And also the definition of homelessness and how it was being used by the traditional point in time count did not work completely for young people. So that was our number one next step. And from that, which is also why we had such a tight timeline, is that it led to this evolved process of engaging young people from many, many different walks of life and experiences, informing the process, informing many levels. So one, informing how would we do it, to the questions that would be asked, to where would we go, and then reflecting on the data along with service providers and some governmental entities. We were funded by the state of Mexico's child welfare entity, and Pyre was the lead researcher and evaluator. And this happened in such a short timeline that we were all working. So, I mean, really, it was like we had to work so closely and so intensely. But I will say that we had already been working together for almost a year in developing where our targets were, what did we want to work on, what did we need. And there was this idea of an assessment. Many times within communities, people are just like, we're researched out, we don't want one other assessment. But there was a groundswelling of desire for this particular assessment. So there really wasn't, everyone knew we needed it. And so there were hardly any barriers because all providers knew that this was a critical assessment to be able to take place. And so everyone was willing to participate. And we're going to see it later on, but the levels of participation from typical community providers, where our participations are very low, often we are not great at responding to surveys, and other types we hit pretty high participation levels because people were very committed to the process.
Yes, and Brooke took part in a leadership team that we put together to help oversee this project, and it included a variety of providers from community-based organizations. As she mentioned, it included government officials. I also want to give a shout out to Danielle Fettis and David Sommerfeld at UCSD, who really played a critical role in the quantitative aspects of this project. We put together an advisory council of youth with lived experience who worked in tandem with the leadership team. We held a variety of small group meetings with youth with lived experience to get input. We also hired youth with lived experience as data collectors, and we did a lot of consultation with street outreach teams and other people who serve these youth. And I just want to give you a sense of the magnitude of what we did in like 6 months. And David Sommerfeld said it's like 3 NIH studies on a dime. We really did think about this in terms of the EPIS, and we were thinking we need to do something very multi-level. We did what's called a youth count and housing survey using a method called capture recapture to estimate the size of the population. We did a landscape survey where we really tried to get the big picture about all the agencies and the services they were providing, their needs when working with youth with lived experience. We did what I thought was really cool, and we have to do something more with this data. We did an organizational workforce assessment. And as Brooke said, this is pretty amazing that we got an 82% response rate for people who are working with this population. We also did, a deeper dive into understanding the lived experiences of youth who are experiencing homelessness, and then we used qualitative interviews. We also did a qualitative system assessment where we talked to, state leaders, city leaders, county leaders, and then we did a qualitative organizational assessment where we did provider interviews and focus groups. And again, the Youth Advisory Council and our leadership team really did vet all our study instruments. And they told us this would work, this might not work, this is too long, stop asking that many questions. So they tried to make it feasible to implement. We co-designed a training for our youth data collectors. And some of the topics in this, I think it was a 2-day training, and then there was some booster trainings, but where we introduced them to the notion of a youth count, how to do the survey, really what is capture recapture, how do we implement it. We talked about basic procedural issues like maintaining your data securely while you're in the field. But I think what's even more important, and this is where we really had to rely on our community partners, but how do we work with unstably housed youth in trauma-informed ways? And then what are the ethical considerations when working with this population, and how do we protect them as participants in research? And then also maintaining safety for the data collectors and the participants while in the field. There were a couple of situations where we had to exit let's say a street location where we were engaged in our count because of various activities happening. And so that's something we had to give special attention to in our training. And our training really did involve interactive exercises, role plays, lots of practice, and of course, lots and lots of rich discussion. And the training continued, after people did data collection, and we would do a lot of debriefing and again, the booster trainings. But this was a co-created product. I'm just going to go over very quickly. And again, this is the exploration phase. So this needs assessment is going to kick off, I hope. And I'm thinking Brooke would agree, but a longer line of research studies that will, we hope, have a public health benefit. But we found, and again, we did this during the time of COVID, that up to 2,300 young people between the ages of 15 and 25 are without a stable home. We think this is an undercount. This was our first time doing a count, so we had a lot of lessons learned. But what did we find out about these youth in both the qualitative and the quantitative data? These youth reflect an invisible population, a very diverse population, although Indigenous youth were at particularly high risk, as well as LGBTQ youth. Many of these youth were impacted by systemic harm. So, for example, you can see that 34% of the youth had been in foster care, 40% had been involved in the juvenile justice system at some point, close to over 49% had ever stayed overnight or younger in a jail or prison. So we were able to compare in our survey the experiences of stably housed and unstably housed youth, and you could really see the stark differences here. And many of these youth had left home for good who were under 18. They have major unmet healthcare needs, and over 28% of the youth described their health as poor or fair. 24% had been using the emergency room 3 or more times in the past year. 38% had a physical disability or a long-term health condition, and 38% said their mental health was not good most of the time and always in the past 30 days. And I'm not sharing the findings of the youth who were stably housed, but there were stark differences. Why couldn't these youth access help? Oftentimes there were barriers at multiple levels. So not knowing about the resources, wanting to be self-reliant, fear of being judged, and especially for kids who were LGBTQ, this was a big consideration. Behavioral health struggles, unmet behavioral health needs, and also distrust of services. And we found in particular when people were using the adult system of care, so for the older youth, they had some negative experiences in those settings that are generally not trauma-informed, not necessarily LGBTQ friendly, but this distrust kind of makes people reluctant to use services. At the system level, there were things like parental consent requirements. So you really can't get housing support unless there's a caregiver who signs off. So it puts kids in a catch-22. Issues of paperwork and technology to access services, not having documentation like an ID, and again, not actually having the services, not having appropriate housing and behavioral health services. And there was discrimination, a structurally based barrier based on race, ethnicity, gender, and sexuality. The ideal living situation for some of these youth, they want something that's safe and private. They don't want to be on the streets. They were very much interested in having a small house or an apartment where they were away from drug use, theft, and violence. They wanted formal support, help with life skills. Many were really receptive to the idea of having case management, wanting health and behavioral health services. And what did they want? They want independence. They want to be sober. They want to have access to things like transportation so they could actually go to school and get a job. And they want that job to pay rent and expenses. So we have this huge report, and you can access this report on our website. And we have 14 pages of recommendations. But ultimately, to distill them, it's really, we need to prioritize youth voice in aligning and changing the multi-level system. We have to really enable collaboration among all the different organizations and among all the different government entities if we want to enhance the continuum of services. We have to invest in and grow our agencies and our workforce. And we really do need to step up our game when it comes to providing trauma-informed care throughout the continuum. And I'm really going to just ask Brooke if she wouldn't mind talking about what we use some of our data for, or what and how we'll be using it in the future.
Sure. The second, when I talked about the 3 primary strategies that came out of our youth subcommittee, the first was the assessment. The second was a young adult shelter. And so we were also curious to see when the assessment was in process, if the young adult shelter would also rise as a recommendation, and it did. And so from that, many governmental entities have gone after funds to be able to build a young adult shelter. So for young people 18 to 25, to address some of those concerns for young people who are entering the adult system, who really at a developmental level were not receiving the kind of support that they need, since we know that when the brain is finished developing and what trauma and substance use, what its impact is on young people who are developing, they really need a different type of support. And so many of the adult providers are not providing that. So moving towards a young adult shelter was one of the primary goals, and government entities are creating a pathway towards that, and we hope that that will come to fruition. It's led to much more visibility around. You can see all of the different meetings and media connections and visibility for the idea that young people experiencing homelessness is a different experience, and that we need to address the developmental needs of young people, that it's not just about a house, that housing is important, but it's also this layered need of looking at trauma, looking at mental health and behavioral health needs, looking at different types of disabilities and system impact. Many of the young people, as you could see from the previous slides, were impacted on many levels from the juvenile justice system, child welfare system, and the behavioral health system. And so thinking about how do we support young people who have been institutionalized for long periods of time during their key developmental periods. So how do we support them in being ready for that stage of independence? And all of these factors, the assessment is really raising awareness and creating opportunities for dialogue and an urgency. Prior to the assessment, just before the assessment launched, the city of Albuquerque had never funded a youth service entity to provide housing. And now every major youth housing provider has received money from the city of Albuquerque to provide housing support. So it really shows the direct connection. As you raise awareness, there can be additional supports, and that will lead to change within a system. So we're now at a place where 3 years ago, I believe, I can speak for our own agency. 3 years ago, we had about 22 beds available for young people, and now we have 69. That's one agency within our community, and every single one of the youth housing providers have increased, doubled to tripled their capacity. And this, when we are working together, to me, this is the actual benefit to being in true partnership and really having the conversations in clear ways. And it's how the research leads to action within a community. Another point was that there's one of the people who was on our leadership committee is now doing some and supporting some of the research that is happening in the southern part of the state. There's an assessment that is occurring there. So this assessment is now being used as a model to complete for other communities across the state to find out what are the needs in those communities and how can we better serve our whole state. And so I really do think it's actually been a catalyst of raising awareness for young people and who are experiencing homelessness, and how as a community we can come together and bring people. So from every level, we had county officials, city officials, state officials, coming together to talk about these issues that previously we really weren't, and thinking about how addressing youth homelessness is a way to do a different type of prevention for adult and chronic homelessness. If we're addressing youth early on, then we are stopping that pipeline before it becomes a chronicity issue.
Thank you, Brooke. I'm gonna move on now to a whole other line of research that's involved Adrian for a very long time. And the project we're going to talk about is reducing adolescent LGBTQ suicide. We call this project RLAS for short. But I would say RLAS is, part of a larger community academic partnership that I think has kind of developed organically, Adrian, and you can tell me if I'm wrong, but we've been involved in, doing research in emergency departments to look specifically at care provision for transgender and gender diverse patients. And this project led to another study that we hope will be funded sometime soon. And it's really using an evidence-based practice that we're tailoring for transgender and gender diverse people, and it's called critical time intervention, and it's a case management program. But our whole thing is not just focusing on individual level, but really focusing on higher order levels. So what are the system barrier barriers? What are the organizational barriers that actually make it difficult for people to access services when they are receiving case management? So we're actually doing a lot. We were hoping to do a lot of work at those other levels. And then this project I'm going to talk about, RLAS, just recently morphed into a new project, which is focused on school-based health centers. And really, how do we incorporate inclusive LGBTQ supportive practices in those settings? So this project I'm going to talk about, RLAS, used a multifaceted implementation strategy. So you talk about language that's accessible, but an implementation strategy called the dynamic adaptation process. And I think this process, also called the DAP, it's something that makes sense to people on the ground. It is a basic kind of like, how do we plan to make change in a particular setting? And our rendition of the DAP involved bringing together teams of diverse school professionals who would implement 6 evidence-based LGBT or evidence-informed LGBTQ supportive practices, with the goal of improving school climate and culture for these youth to reduce their risks for depression, suicide use, and suicide risk. And we think these practices might not just impact LGBTQ youth, but like have a beneficial impact on all youth in schools. There are several examples of the DAP in practice. It's been used to implement a child welfare home visiting program in 4 public health systems. It's been used as a quality improvement tool in clinic settings to address issues of unnecessary antibiotic use in emergency departments, to understand barriers and facilitators to implementing evidence-based programs related to the prevention and management of HIV. We believe ours is the first to promote, use the DAP to promote the adoption of a suite of school-based practices for a health disparity population. The DAP has, it's informed by the EPIS model: exploration, preparation, implementation, and sustainment. So the example we just provided you on the youth needs assessment, that was really during the exploration phase. The exploration phase really does involve looking at different levels: what's happening at the system level, the organizational level, provider level, client level, and then using that information to inform future activities. In the preparation phase, the DAP entails developing an implementation resource team. During the implementation phase, and this is where Adrian was really involved, you're helping people, you're guiding people in implementing their new practices by providing help with training and coaching. This is where you might have some work on adapting what you're doing to either fit to tailor the practice or to tailor the practice to the setting. Ultimately, you're monitoring what you're doing. You're using that feedback to inform your action planning. And during the sustainment process, you're really looking at, well, did we make a difference? But this is an iterative process. So you're always kind of in this cycle of, collecting data, using the data to inform processes, making sure people have what they need so they could actually do those processes, and always looking at what difference you're making. So Adrian, would you mind talking about the practices we were trying to implement?
Yeah, these are just 6 strategies that have been shown over time and through the evidence to be protective strategies for LGBT students in school settings. So, and then the school-based health centers in particular are where these kids tend to come. They tend to think that the nurse in the school is going to be a more accepting and non-judgmental person. And I think they probably also think of that person as maybe having more resources outside of the school, So that's why making sure these folks knew where referrals could go, right? Number 6 there, making sure that people knew where to send people 5 and 6 was really huge. For professional development, we know helps. We train every different type of group, not just school professionals. We train correctional professionals, we train medical professionals, research professionals, judges, lawyers, therapists, anybody you can think of. At our center, we train every type of professional group. And in almost every setting, we can see that even a 2-hour cultural fluency training can bring up the baseline, can help to dispel some of the apprehension that people have about trans and non-binary folks, can make them more confident and capable and comfortable in terms of interacting with us, whether it's colleagues or parents or the kids themselves. And once people feel more confident and more comfortable having conversations and interactions with a population, that population has better access and better safety within that environment. Safe spaces, prohibited, bullying policy, those things have long been shown to be really valuable. And I think in terms of sexual health curricula that includes LGBT kids, we know that makes an enormous difference. LGBTQ youth don't report gleaning a lot from typical health and sex ed because they don't see themselves reflected in it. They don't see that their behaviors are reflected in it. They're not being taught how to keep themselves safe with the sexual behavior that they maybe want to engage in. So making sure that we have at least educational materials, if not weaving that into the curriculum, is a really crucial thing for these kids too, in terms of taking care of themselves, being able to engage in kind of fundamental self-respect and self-care around their burgeoning sexual health and sexual behaviors.
Thank you, Adrian. And when we started out our research, you could kind of get a sense of where schools were nationwide in implementing these practices. And, these percentages are kind of all based on self-report from a key administrator in a school. And what we find is people tend to overestimate the implementation of these practices in real life. So they might have some harassment and bullying policies on the books, but whether they're being enforced is actually quite questionable. Safe spaces, many schools say they were doing safe spaces, but we found that there was a safe zone training, but that happened 6 years ago, and then there's been a complete changeover in staff. Almost 46% of schools nationwide reported having inclusive health education curricula, 76% or 70, close to 77, encouraging professional development. But ultimately, implementing all of these practices, only 15% of schools nationwide. So here is our rendition of the DAP. So you can kind of see how we filled it out. During the exploration phase, we really took a deep dive into doing a school level assessment, looking at policies, leadership support, organizational climate, and readiness. We did this through surveys, through document review, through qualitative interviews. We did same thing with the staff assessment, looking at who's working at the schools, what are their attitudes towards their schools, what are their attitudes towards the practices, and how about what are their attitudes towards LGBTQ people. And then we did a student level assessment, really focusing on some of the bigger data sets out there, such as the Youth Risk Behavioral Surveillance Survey. During the preparation phase, we work with schools to put together their implementation resource teams. These included school nurses, school counselors, social workers, health educators, sometimes librarians. We found that librarians can really play a critical role in creating a safe space. And then we had our implementation coaches also take part. During the implementation phase, we provided training and coaching. And again, Adrian was heavily involved. We engaged in adaptation processes. Again, we did the ongoing feedback throughout. And then our outcomes really centered on adopting LGBTQ supportive practices. And we had some really rigorous fidelity criteria. And we also used the stages of implementation completion tool to kind of look at our implementation progress. And I'm not going to spend a lot of time on this, but let's just say our use of the DAP actually made a difference. We found statistically significant increases in the adoption of the 6 practices across all the schools that were randomized into our implementation condition. And, this pleased us. And I could talk for the next 2 hours about, the factors that influenced adoption, but it made a difference. And why it made a difference is we created this community engaged partnership to really undergird everything. We had our CAP, our Community Academic Partnership, or organized along the lines of a community advisory board. And here we had people from state government, from high schools, from a variety of community-based organizations, including the Transgender Resource Center of the South of New Mexico. And this partnership provided input into all our measures, our how we were pursuing implementation. This is not a good idea to do at a school at this time or in this way. And they also helped us design all our training and technical assistance materials. Then we had our researchers and our community-based trainers who really did help, also craft the training, work with the coaches, provide data to the implementation resource team, help with the tracking of implementation progress. Our coaches, and that should be coaches and community-based trainers they're the ones who provided technical assistance, helped with fidelity monitoring. And they also were really great in terms of being that bridging factor, helping to link schools to resources in their communities that before they didn't know about. So if they wanted help with creating an inclusive health education curriculum, they knew who to go to in the community who would actually be knowledgeable and helpful in this way. And then in terms of participation, you had the people on the implementation resource teams, including their leaders and their members. And these folks really did take the lead in assessment, action planning, and in implementing the practices. And then, in terms of this multi-tiered structure, there were the students, and many students participated in the implementation resource teams. But this is kind of like an overview of how we organized our larger community engagement infrastructure. And here is just some of our partners. So you could see, like, we had a variety of partners, national and local, and also, people who are in the schools, and they made that project a success. And you can see our website link here, and it will be in the slides that will be made possible to available to you. But on our website, you can access some of our training resources and other materials if you're interested in this topic. So I think that's enough of me talking. And I had some questions for our 2 panelists here. Are there any questions before I launch into some of these questions? And I don't expect we'll get through all of these questions. And I have not been monitoring the chat. So if Brooke and Adrian, if you see a question, or Borshika, if you have a question.
I am looking at it. I don't see very specific questions. I asked about how many total items you were able to implement successfully with the participants, and Adrian shared that it's about 200 items, which is...
Mine was addressing something else, though. So your question to Katie still stands. I was talking about the number of homeless youth that Brooke had said the department said was 200, but they said was 2,300. Yeah. So Katie answered that.
So, how many? All the practices were implemented, some more successfully than others. And we did create very rigorous criteria. Like, in some ways, our fidelity criteria like made the bar super high. But even with that high bar, we were able to detect statistically significant changes. And we are working on that paper as I speak. I think there's somebody working on my edits. Does that answer?
So that's one. And then the other one, you mentioned that you used very extensive instruments. And I was wondering how many items of, they had to complete. You were showing all those different instruments because it seemed like that was a very big undertaking to get all those instruments completed.
Yeah. So the instruments we're talking about which study? Our last study? The last study?
No, the one before. It was an earlier question. Yeah.
Oh, okay. Yes, we created, first we had to create our capture recapture protocol. Then we had to design a survey that could be implemented in 10 minutes or less, and that was understandable to, a wide variety of youth of different developmental stages. Then we created a larger landscape survey, and we designed that to be completed in 45 minutes or less. And Brooke, you can refresh my memory, but like it did ask about, the types of services provided, funding resources, trainings that organizations could provide locally, and trainings that they needed. And in our report, you can get a good sense of the types of questions we asked. We also asked about collaboration. What does collaboration look among the different organizations comprising the provider network? And then we did our workforce survey, and again, both Danielle and David were instrumental with both of those surveys, where we looked at things like job satisfaction, issues of turnover, training needs, just implementation, climate type questions. So we have lots of fun data. And if there's any kind of industrious people out there who want to kind of do a pass on some of this data, maybe talk to me. We designed a qualitative interview for the youth, and we had to be very flexible in implementing that guide. With some, you kind of like work with youth with how they want to tell their story. Mm-hmm. And some of these youth have had to tell their stories many, many times. So you just kind of really have to be sensitive in terms of how you're asking people about their lived experiences. And then, there were the interviews and the focus groups with the system leaders and with the people who work in the community-based organizations. And they were designed to be very complementary in terms of like, what do system leaders say about this? What do people who are actually in the trenches say about this? So what do they say about how the city and the county and the organizations collaborate? And so you're able to kind of see where there's differences and when there's similarities. I will say, in terms of triangulation with our qualitative data, there was just like a lot of people on the same page. So I can say like the information provided in our report is I have high confidence in it. And Brooke, in terms of member checking, what would you say in terms of our instruments and what we were able to garner?
I did just want to note that the very first, to me, the most important survey was that initial survey that was done for young people who are on the streets. Because I think this goes back to something Katie mentioned early on about asking the right questions and coming up with, and thinking about the audience that you're trying to reach. That they were standing on the streets of Albuquerque trying to engage with young people. You could not have some 150 item survey that people were trying to implement. And so really making it 10 minutes, saying that people will get something at the end of that, and making it really user friendly. So the words that people were using, we did a lot of work to make sure that there wasn't jargon in it, that young people would be able to understand, and that it was we could get the really essential data that we needed in a reasonable amount of time and this to me is an ethical consideration for the young people that we were trying to find out what was going on. And I just, being a part of other types of community research and where there's not always collaboration, I will say that is the key piece that is often missing is that when we were not collaborated ahead of time, and Adrian, I don't know if you've had a similar experience, when we are not collaborated with ahead of time, but then after the fact, when instruments and survey types of evidence-based surveys were already approved, often what we get are very extensive surveys that are really not the appropriate type of survey or length of time or anything that would help us actually garner the data we're looking for to answer the questions that we want, because it's too involved. The language is not correct. It's going to take too long. It's a trauma deep dive or whatever. And so I just think one of the really huge strengths was coming up with that 10-minute survey that was very accessible.
Super helpful. Thank you so much. Very, very good. I'm looking at the chat, and for now, I don't see other questions. So I want to hand it back to you, Katie, because you have some great ones for the panelists.
Well, I'm wondering if we could just continue in terms of the issues that Brooke just raised, like what happens when community partners are missing from research with, you know, the populations your organization serve. And maybe not even just research, maybe we put research/evaluation.
I mean, I think y'all are saying it, but it just becomes completely two-dimensional. It's of no use to the community usually, and it's really only for somebody's like, PhD or whatever. We've had 1 million people over the years want to come to our drop-in center and ask our participants questions, and typically we just don't allow that. We don't even know what your questions are, and we have no idea how those questions are inevitably supposed to help these people, because for us, that's the point. We're a community-based organization. So to me, it's not how does it enhance our organization? It's how does it enhance resources and access and safety for trans and non-binary people all over New Mexico? So the school-based health center study was a no-brainer for us. We want school-based health centers in every part of the state to be even slightly more educated and competent around this. Even a minor boost in the baseline would make a big difference to these kids, but this study was going to boost it quite a bit. We want to resource those people who look like the resources to the kids. We called ourselves the Transgender Resource Center from the very beginning to remember not to create a resource that we could help to cultivate instead, and so participating in this kind of research is the essence of what we're trying to do, which is get the resources in our state to be better for the population we serve. And without community partners, you can almost guarantee that won't happen, that it's too inwardly focused on an academic level, right? It's focused on academia and not on what is the outcome that the community could point to and say, it's good that these people came because look what happened,
Thank you.
I can also say the myths that we've often experienced is when some entity, whether it's a governmental entity, a research entity, has written a grant proposal ahead of time, and they were just doing what they were doing, thinking, looking, finding evidence-based models, and they've committed to using these models, and they look good on paper, and they've shown great results. But as I've said, when I said that 150 assessment, we're in this experience right now where there is, in a drop-in center, they're wanting us to use 150 item assessment. It's not going to happen. The young people are coming through the door. They're not going to sit down to complete a survey that would take anywhere from 45 minutes to an hour even if it's compensated. It's just not in alignment with the population that we're engaged and who's coming through the door. And so if we really want to get the answers and we want to have the perspective of of a particular population, we have to keep them in mind when we're choosing tools, choosing assessments, choosing whatever. That not the assessment alone doesn't have to just, there's good results with it. But who is taking the assessment? Who and in what environment are we thinking that this would be happening? In a drop-in center, that's just not an environment where people are completing long, drawn out evaluation types of activities. So, I mean, we've had to say to funders and other people, we're sorry, we understand, but that's not something we will be able to do, because it does, for me, become an ethical concern of making sure that we're able to support the young people who are walking through the door in the most meaningful way.
Yeah. Do you all have any other best practice advice for researchers wanting to work with community partners such as yourselves in meaningful ways?
I can't think of anything you haven't already said. I would stress on come to us before you start writing the grant, come and talk to us. If you want us to participate and help you gain access to the population, then you got to come and include us in the first place, because you can see that we're going to have good advice for you about it, right? And then the second thing I would say is the resource sharing. It's a huge thing, make sure that you're compensating people at every level for their time and their stories and their energy in participating in something like this. It's yeah, that's a really huge part of it, is to make sure you think about everything you said, Katie, like transportation, childcare, like what we want something from these folks, but we often just think they should show up and volunteer to do it, and we're asking for something that they're the only ones who have. So how do we make sure that it makes for a good relationship for them too?
I'm wondering, like, have there been any kind of like negative experiences you've had with research, or have there been any harms that you may have experienced, or your organizations may have been have experienced, and then like how can researchers kind of like repair those harms? Sorry, I know that wasn't on the list.
Well, I can share that um, the primary places that we have experienced, I mean, I believe a lot in evaluation and in research, but I think that sometimes when funding entities, it might be governmental, it may be other, but funding entities, when they um, are interested in doing research, but the challenge is when you talked about the dynamics of power, and particularly the asymmetrical power dynamic, that is where it gets tricky, because evaluation and or research, if the intention is to understand this goes back to the questions that we're asking, and intentionality around how we're using research and how we're using evaluation, and what is the long-term impact. Because when funding is involved, then is the intention and purpose to understand what is working. And then that goes to another level of, is it to understand what is working and to then correct or build something that is stronger and better? Or is it to defund entities if they're not doing what someone is thinking that should be done? So we've had an experience where our theory of change didn't completely align. And so the thing that was wanting to, the questions that the evaluators were asking were not the questions we were trying to answer. And so they were applying questions because the funder was interested in those questions, but they really weren't in alignment with what our actual practice was. So when the evaluation came out, it looked like we were not doing these core things, but those weren't the questions that we were trying to answer. Those were not the performance metrics we were using. Those were not that was not our intention. And so I do think that it is a very tricky and ethical and difficult place when we are mixing the power dynamics and not really being clear and honoring what is the purpose here, and what are the possible ramifications if something is not in alignment.
Thank you. Adrian, have you all had any experiences along those lines?
I think ours have been much more around this thing of wanting to drop in, wanting to just drop in and get information and stories and stuff from participants and then just go peace out. And we had no idea whatever even happened to them or to that information, So I don't know if those people can necessarily come back and repair it with us or if there's any utility to that. But to me, that's why we want to keep teaching researchers around this topic. You know why it's so great what you do, Katie? Like teaching people to come and be more sincere and to have an aim in mind and to share goals and values around this stuff is huge. Because for us, the bad experiences we've had have been mainly based in not seeing that. For me, it's interesting. One of our very first experiences with research was amazing. We have a friend who's still a really great friend. She's a professor at Texas Tech, I think now, and she did organizational change and organizational communication studies. And she came and spent like 2, maybe 3 years with us real early on in our drop-in days and was a hardcore star volunteer, did all kinds of job readiness stuff with people, made deep relationships with some of the participants, and then did, in fact, write her dissertation on our young, evolving organization. But she had contributed so much more value to us than we could ever have contributed to her project. It was like the ideal almost. So we were spoiled in the beginning by a really great researcher who somehow knew all of this and was intent on doing it in what felt like the right way. And so for us, everything else has looked stupid. We don't want people to come to the center and just ask people questions and leave. Like that just does not make sense for us or for our folks. I wanted to just go back to what Brooke was saying too. Like the best survey we've ever seen of trans people so far is called the U.S. Transgender Survey. It was administered in 2005 and then again in 2015 and then not again until 2022. We're waiting for the new data right now.
It's out. I saw the.
It's out.
I'll find it. I'll drop it.
Oh my God. Okay. So in 2015, we got 28,000 people to answer. This year, I don't even know how many, but probably a much bigger number. But at our drop-in center, some of the most affected trans people, at least in the Albuquerque metro area, we have a really hard time getting them to take this really important survey because it takes about an hour or more. And it's trauma deep dive, as you said, right? It's like horrible. It's horrible, but this data is it's so important. We use this data every day to try to teach people about what's going on with trans folks. But it turns out, of course, by necessity, that there are some people who never get their voice included in that survey because they cannot stand to do the instrument that has to be used to do it. So there's that natural tendency to ask as many questions as they do, and they do need to ask about people's worst, most violent experiences, but that does then automatically exclude some part of our population from weighing in on the survey where those are the voices we'd really like to hear there, So that's so crucial that you drop in centers, you got to be thinking about who you want to talk to you and can they even talk to you that way, the way you're proposing that they do it.
I think those are all excellent points. I'm just wondering, does anybody else have anything to add? I mean, I really do think what Adrienne would just talked about, the prolonged engagement and the development of the relationships that the elements of co-creation that we talked about earlier in terms of like reciprocity, having mutually beneficial relationships. I think those are some of the absolute keys to really doing meaningful, community-based implementation science.
I have a challenging question and not necessarily adding to this very, very comprehensively sounding list that you just summarized, Katie. One of the challenges we find as we are trying to engage in co-creation is to balance what funders are willing to pay for and what the community really wants and needs. And so I would love to hear how you think about that, because often we are kind of coming to communities because we know there is a funding opportunity and we want to take advantage of it. And even if we co-create with them something, it is going to be around that RFA or other type of kind of call and not necessarily hitting on the key priorities that that particular community has. So I don't know if you wanted to speak to that.
I mean, this might not be a very satisfactory answer, but sometimes you do things without the funding. I mean, you do things to ultimately create, more useful research projects down the road and more meaningful data. And if we just tie everything we do to having the funding, being able, I have to fill out a time card, but it's just not going to happen all the time. So when we had that slide earlier in terms of what we did after we collected the data from the needs assessment, we did all those presentations. We were not funded to do those presentations. Like I kind of felt like we had an obligation. We were privileged to be able to do this work. And I just felt like we need to also see it through to the next phases. And I know that's not a very satisfactory answer, but like part of what we do, we do. And I think that also goes into resource sharing. So even if, you know what I mean, we might not always have like, here is the, the equitable distribution of the money within that budget. There's other resources that we're bringing to bear.
I would say too, and this is, I mean, I'm not a researcher, so I'm not speaking to y'all's profession, but early on, we had to educate our funders in the trans movement. A lot of the funders would only fund advocacy work or services. And we've always done both of those things plus education because we're the only trans organization in the state. So we were like, even if we do it imperfectly, we have to try to do all of these things. And when we would write grant applications saying, look at all this amazing stuff we do, they'd be like, sorry, that's too much. We only want to do advocacy. And instead of learning to write my grant applications to only talk about the thing they were doing, we got the opportunity to go up and teach ARCIS, the ARCIS Foundation. A bunch of trans movement leaders went up there many years ago and taught them why in our movement we got to combine these things, because your most affected people can't engage in advocacy if they're also dying, if they don't have anything to eat, if they don't have a place to live, right? So we taught them, and then they started funding all these different organizations that were doing more like different things, new things that hadn't been done before, So I think same thing with y'all. I bet a lot of these funds come from the same places, the NIH and all that stuff, right? So how do you get into conference spaces or educational spaces with them to help them see why these things are important and why engaging the community is so important, and how that could actually change the things that you're researching in the first place, right? Teach
That's
them.
what that's exactly, I feel the same way. And I think that that's why it's so important for researchers to be partnering early and building the relationships, because then you will know how to say, this isn't quite the right thing. So one example, there was a funding proposal that was completely evidence-based, focused on providing different types of behavioral health clinical services. And our response to that funding proposal was, transition age young people are exhausted of formal clinical services, and they are looking for therapeutic environments, not all of the menu of clinical services that the funding opportunity was providing. And we made a case for what would therapeutic environments look like, and how this funding could have the similar type of impact, but without those things. And we were funded. And so I think this is why it's so essential to have these relationships early on, so that before you're writing the grant, you're having these meaningful conversations, and that guides how you write.
Okay, I hear you.
I'm sorry. I just wanted to say this was so helpful. Thank you so much, all three of you, to comment on this. This will close our session, if that's okay for this part. And Carrie's showing us the evaluation link. Please complete it. We would love to hear from you. Please remember to connect us for the next session. And then you can also see contact information for our different sponsors for this event.